Makes a good chiropractor? Earlier this week I had somebody come in and they said, Dr. JJ, what makes a good chiropractor? Because I've been around and I've seen certain people, but all the different chiropractors are different, and I just don't understand what defines a good chiropractor. I said, that's a great question. I think I'm going to make that my next YouTube clip. So here's the answer to that question. A good chiropractor is going to possess three things. They're going to possess a very strong ethical philosophy of what it is they're doing and why they're doing it. They're going to possess the ability to perform a technique of chiropractic adjustment that's effective, thorough, and is safe, and makes sense to the patient. And the third thing is the business aspect. So we're looking at philosophy, technique, and business. A good chiropractor is going to have a strong hold on all three of those. Unfortunately, there's a lot of chiropractors when it comes to those things that don't make sense. When they meet you or you see them on the street or they talk to you about coming in, what they tell you they're going to have for you, they don't actually have in the office. That's a breakdown in business. Some of the chiropractors also do things, but they bill differently from what they actually do or tell you they're doing. That's also a breakdown in business. Some of the chiropractors' techniques are not solid. They either don't look or find things properly, therefore they can't help you, or they're not actually able to correct the problems thoroughly. And so when it comes to technique, you're looking at a combination of being able to find problems, but also being able to fix them. And that's an art of being able to perform a good chiropractic adjustment, but also being able to diagnose and find the problems correctly. That's a rare combination of technique to be able to do both those things very well. Sometimes you'll find a shortcoming in that with chiropractors and their technique, because they'll actually only find the things that they can fix. And that's a very narrow-minded view, and it doesn't help everybody. The last thing we talk about is philosophy, probably the most important thing. It ties all of these things in and makes sure that from the moment a patient fills out paperwork, meets an office, gets a phone call, receives a treatment, does billing, everything makes sense. They understand what it is they're doing, why they're doing it, and how it helps them, and they're able to tell other people about it. It comes down to being ethical, being honest, being able to have choices. In our clinic, we don't make people go through things they don't want. We don't sell anything. There is relief care. There is corrective care. The patient chooses what they deserve and need and feel is necessary, and we provide that service to them and make them happy and satisfied, so there's no false expectations. Those are the three things I think make up a good chiropractor, and I hope that's what you see in our office.